on PCO and you, but yesterday I also took a lecture on the PCOS phenotype and what is new in the management and all, but I think very less emphasis is given on stress. So I thought it's a good, when you're talking about GDM in particular, maybe it's a good idea to talk a little bit about PCO. And then these PCO girls are at a higher risk of GDM. So how to deal with them when they actually conceive and how to go about that. So I thought it'll make a good, interesting meeting. So with that, I will just go on to the first part of thing. It's a lecture which I had thought what I do in my practice, I will tell you. And I was sort of jolted into thinking about this particular topic when one of my patients about 4-5 years back, I just came to know a 26-year-old infertile PCO girl. Infertile girl was coming for treatment. She committed suicide. And we as gynecologists hardly ever even realize when these young patients come to us with a problem of either PCO or infertility, how stressed they are. I had no clue. I had no clue this woman is stressed because she used to come with her husband and the mother-in-law, and invariably the mother-in-law and the husband would speak and she would sit quiet. And I think it's a quite common scenario in all our OPDs. That is what happens. And we don't really inquire what is happening in their, what about their stress levels. So this incident made me think that how can a gynecologist sitting in his busy OPD, seeing patients day in, day out, infertile patients, how much or what can we do to at least elicit or come to know a little bit about the stress which a patient is undergoing? So with that in mind, this lecture was made on, and I did a little bit of work on this. I'll share with you of course, when you talk only of a PCO girl, even if it's a young adolescent girl, there are a lot of causes for the stress, because a young adolescent girl is very, very worried when she's got acne or she's got hirsutism, and of course infertility and increased BMI if they're obese. It's linked to mood and distress, and they're always very stressed about the things. So basically, this is a chronic process. You are telling this woman, okay, now you lose weight. This girl cannot lose weight, it becomes frustrating, or she loses weight for 6 months, then it puts on back again because lifestyle is like this. Time nahi hai exercise karne ka. So it's a very frustrating disorder, PCO. So keep up with it, they have to really work hard, and that is what we have to counsel them for. So all this thing causes a lot of stress. A meta-analysis of 10 studies reported increased depressive symptom scores in 44% of the patients who had PCO versus 17% in control. So PCO patients are definitely more depressed and more stressed out. 4 studies reported a 7-fold increase in abnormal anxiety scores. It is important to recognize that these patients are stressed. A large international survey has shown that most women report psychological issues are under-recognized, and less than 5% are satisfied by the emotional support and counseling which they get. So I think it's high time the gynecologists take this matter up and start looking at stress and counseling them on how to deal with stress. So even the international evidence guidelines of ASH, which were published in ASH, the PCOS ovarian syndrome in 2018, say that health professionals should be aware that in PCOS, there is a high prevalence of moderate to severe anxiety and depressive symptoms in adults, and a likely increased prevalence in adolescents. Anxiety and depressive symptoms should be routinely screened for in all adolescent and women with PCOS as diagnosis. If screening for these symptoms and for other aspects of emotional well-being is positive, further assessment and or referral for assessment and treatment should be completed by suitably qualified health professionals informed by the regional guidelines. If treatment is warranted, psychological therapy and pharmacological treatment should be offered in PCOS, and an optimal interval of anxiety and depressive symptom screening is not known. Means how often do you do it? We don't know, but at least in our setup in India, at least let's start doing something about it. We'll come to it how often one should do it. So is it easy to diagnose stress? How do we recognize that the patient is stressed? Do we ask leading questions? Well, it's very difficult to basically ask leading questions, but I think it is time we start doing it. That no, we have to do. And I found a very useful well-being index, the WHO 5 well-being index. There are a lot of indexes on the net. Infertility stress. There's a lot of uh, infertility centers have different ways of screening for stress, and they make the patient fill up these forms before they come in. What I do is I found this very simple, just 5 questions over here, and it is by the WHO. And I have felt cheerful and good in spirits. I have felt calm and relaxed. I have felt active and vigorous. I woke up feeling fresh and refreshed. My daily life has been filled with things that impress me. So they have to mark one of these. All the time, most of the time, more than half the time, less than half the time, some of the time, or at no time at all. So if no time is 0, then some of the time is 1. So obviously, if the score is lower, the patient is more stressed. So the raw score ranges from 0 to 25. Then the scores are transformed to 0 to 100 by multiplying by 4. With higher score means better well-being. So evidence suggests a score of 50 or below is inactive or indicative of low mood, though not necessarily depression. And a score of 28 or below indicates likely depression and warrants further assessment. So these are the patients which you really have to uh, take out from that whole bunch of patients which come to you and address their stress separately. And if the score is below 50, they definitely require some emotional support. So the other question which comes up is, when you talk about infertility, can stress affect fertility? So in a stress induced, the recent research tells us that stress boosts the level of stress hormones such as adrenaline, catecholamines, corticosteroids, which can inhibit the release of GnRH. And subsequently, this may suppress ovulation in some women and reduce the sperm count in some men, because a high cortisol in a female will inhibit GnRH, reduce LH, reduce FSH, reduce estrogen, impair the follicular development, and affect oocyte quality. So all these things are attributed to a high cortisol. And a high cortisol in a male can inhibit GnRH, reduce LSH and FSH, reduce testosterone, affect spermatogenesis, and reduce the sperm count. So basically, we know that there is some association between stress and infertility. Many patients ask us, we are stressed, could that be causing the problem of our infertility? So research published in fertility and sterility, experts at the University of California at San Diego reported that stress may play a role in success of infertility treatments, including IVF. So they have done studies to prove that women with stress have ovulated less, had fewer eggs, and those who are more stressed were 20% less likely to achieve fertilization success. So stress and anxiety scores in first and repeat IVF. Another study which says that stress and anxiety levels remain elevated across all cycles. Anyone on an IVF cycle is obviously stressed. Women with lower stress and anxiety levels on a day prior to oocyte retrieval had a higher pregnancy rate. These results emphasize the need to investigate stress and reduce modalities and stress reduction modalities during the IVF cycle. So basically, all the studies, even large studies like the Swedish study of 22,000 women, says that yes, there is underlying stress which has to be recognized and addressed and treated. So managing stress is an important component of our treatment also. So what can we offer them? Now, in general, we say, Are, you ask them about stress, they say, oh, I'm very stressed. No, no, relax, relax. But only saying relax doesn't help. In fact, they say it is counterproductive. You're telling relax has no effect on her. So don't try to just relax because you think that's going to help you to get pregnant. But just relax because it feels good, because it is comfortable, and because when you feel good, you are healthier overall. And conception and overall, and that can never be a bad thing for conception. If you realize today in COVID times also, what they say, it is very important to have a positive and always a good outlook. You can't get depressed in COVID times because that is counterproductive. Your immunity goes down, and it's a very clear. Even today on Facebook, there was Dr. Shashank Joshi who was talking about it with Dr. Harish Shetty. They said, no, you have to have a very positive and a strong outlook if you want your immune system to work well and prevent you against COVID. So it is important. Stress is important. And what are people trying to reduce stress in infertility patients? Acupuncture treatments just prior and to and after embryo transfer, people have found a higher pregnancy rate after trying acupuncture. So no definite studies, but they say it could help. The numbers are very small, of course. Some people are trying massage, where they say that even foot massage before and after their thing, the embryo transfer, it's important because it reduces their stress. Some people are trying yoga and guided imaginary foot reflexology. You know, they have this thing of foot reflexology, and they all say that in their centers where they are trying, Griffo in his center and all that, it helps people to relax and they have better outcomes. But what can we in India? We don't have a large building with an IVF center where we can have one room for yoga, one room for massage, one room for acupuncture. So what can we do in our consulting rooms? As a gynecologist, I think it's our duty to spend a little more time with these patients. If I get that patient who fills up this in the OPD, the WHO index, and if I find that the index is low, give them extra 5 minutes during consultation to address the issue of stress. And I believe you women who are sitting over there, I mean, as a women gynecologist, you can probe much better into the stress aspect of women, and she will relate much better to you because many of these girls don't open up to us males. Someone lending a sympathetic ear to their problem also helps them to cope up. Simply listening to them also helps. Exercise, what can you tell them? That listen, get out, do a little bit of exercise, do a little bit of musculoskeletal activity, and that releases endorphins in the brain, so that will help you to reduce the stress. It's a wonderful way of reducing stress. Distract with a hobby, take a break, yoga, meditation, all these things, even suggestions, if we give them, some of them may take up and they may be hugely benefited. And of course, tell them, don't take life so seriously. There is one book, this is the reason I put it up. There's one book available on the net also, on Kindle also. Laughing is Conceivable. Now, this is one book which a patient has written up after failed IVF attempts, and then how she got pregnant, and she's taken the funny side of the full treatment. So we as doctors will never come to know about it, but in this book which she has written, Laughing is Conceivable, it is nice to read. And I tell my patients, just you're going for an IVF treatment, okay, read this book and then go for it. So at least they know that she's not the only woman undergoing all that stress, and there is a side to it, a funny side to it also. So we can give them simple mantras like control your thoughts. Now, we are no gurus or to give it, but the controlling your thoughts is also not easy. It's easy to say control your thoughts, but it is not easy. So can we give them some simple uh, techniques? And one of the techniques which actually works is saying cancel. Like when there is a virus in the computer, you all obviously delete. Similarly, whenever you have tell them if you have some bad thought or some negative thought coming in your brain and you know that this is counterproductive, it's not working. In our daily lives, we get so many negative thoughts. Right? COVID to nahi ho jayega. Mask पहनना भूल गए. Just cancel those thoughts because they are counterproductive. You have to loudly say cancel, cancel, cancel. Initially, in a day, you may say it 1,000 times or 10,000 times, but gradually, once you get in the habit of recognizing that this thought which comes needs to be cancelled, then that will work, and you'll find yourself much calmer and much more better if you can control and do this. So you'll be more mindful rather than having mind full of thoughts. So that is one thing, being mindful of everything, everyday things. Now, another small technique which I have is a 5-minute miracle, which I tell my patients to do. And this is simply something which you have to, I tell them, uh, maybe with your husband, sit with your husband 5 minutes opposite each other, close your eyes, hold your hands, and think only of the result which you want. So you want a baby. So just think as if the baby has already happened, the baby is playing with you, how it happened, kaise hoga, kab hoga, kaun se doctor ke saath hoga, forget about it. Just think about the result. You are sending an intention to the force, and that will manifest. You are sending an image of the manifested infant, and that is a psychological behind the theory behind it, but it is just it's a simple exercise. If nothing else, at least 5 minutes they'll have some positive image in front of them and they'll feel better about it. So this 5-minute miracle I tell them to do. And there is something known as an attitude of gratitude, and I hope this video can play. Sorry. This is by Nithya Shanti, who had given me these techniques.
I'd like to talk about a very simple practice which we can do every morning when we wake up. I call it the lotus of gratitude. Now, as you know, a lotus grows out of the mud. The quality of the lotus is that when the sun shines on it, it starts to slowly blossom, slowly open. And each time it opens, it reveals another inner layer of even more delicate, even more beautiful petals. Each layer is more beautiful than the next. So in this practice, you wake up in the morning, you sit in bed, and you put your 10 fingertips together close to your heart. What you'll do is, you will start thinking of all that's beautiful, all that's really supporting you in your life. Could be people, could be situations, could be qualities, could be learnings, could be anything. And each time you think of something, you will open one of your fingers like a layer of petals. And you will inwardly say, I'm so thankful. And then think of something else. And inwardly say, I'm so thankful. And like this, petal after petal after petal. And go on to open all the 10 fingers. And as you open the 10th finger, bring both your hands on your heart. And feel truly blessed. Feel like the luckiest, most supported, most loved person in the world. Most fortunate being in the world. Like the favorite child of the universe. And feel truly like you're sitting right in the middle of a big, fragrant lotus. Your whole life is like a lotus field of gratitude. And that's a simple practice we can start our day with. You could even end our day with that practice. And in this way, what we focus on expands. If you start your day focusing on what's right, celebrating what's right in your life, you start finding throughout your day you see more, you notice more, you enjoy more, you appreciate more the simple blessings that are already there. So try the simple practice of the lotus of gratitude. May you make every day a more grateful, more beautiful day.
So that was Nithya Shanti, the person who has given me a little more techniques like this 5-minute miracle and other the cancel therapy, which he's a sort of lifestyle guru. Very interesting, and he speaks very well. So that was for you, and I saw some of the doctors were really enjoying this. Thank you for that. Now, other mind exercises are, of course, hypnotherapy, cognitive behavioral therapy, and mindfulness, which, of course, is a more specialized technique. If you find your patient is a little more depressed, don't hesitate to refer them to somebody who can help them, whether it's a psychiatrist or a psychologist or something, and they will do something about it, instead of just not doing or anything after recognizing stress, not doing it. And believe me, in our patients, most of the patients will be able to handle ourselves. But there will be patients, some of them will be very depressed and who will require either hypnotherapy or even pharmacological treatment. So, you have to look out for things like suicidal tendencies. You can't let somebody give up the life just because you're infertile or something like that. So you have anti-anxiety drugs, you have help available. Our job is to recognize this and then offer them the help which they require. If they are more depressed, if they're suicidal, I mean, sometimes I ask this question to my psychiatrist friend. He says, yeah, you don't have to hesitate. You have to be very direct and ask them, do you have suicidal tendencies? And if they reply yes, please don't wait. Just refer them to a psychiatrist for specialized training. So we must take it upon ourselves. Of course, there are drugs like alpha casopin, is like casein in milk, available as Oraspa, also harmless drug, which I have used in some patients, and they found a little relief for a couple of months, 2-3 months. They took it. So basically, when you talk about managing stress, talk to them about stress. The WHO 5 thing is available, or any other thing which you like. You can keep in your waiting room, or tell them to fill it up before you, or and show it to you. Give them simple things to do. Open up their world a little bit. Tell them that a little bit of exercise helps. Maybe yoga, maybe cancel, maybe the 5 minute miracle, lotus of gratitude. Any of these things we can impart on them by just talking to them for 5 or 10 minutes. So we can do that in 5 or 10 minutes as we are concerned. But if they are more stressed out, don't hesitate to refer for hypnotherapy or psychiatrist and think of drugs. So thank you very much for this. This is one small booklet which contains all these techniques which I have printed for the patients, and I give it to them if I find that the score is below 50. Sometimes I give it to all patients, but mostly the ones whose score is below 50, I give it to them and I say that just go through it. It also describes a little bit about what IUI is, what infertility management is. So if you want, you can write to me at thanawala@maternity.com and I can email it to you anyway, and you can use it the way you want. It's absolutely a done thing. So for any of you who would like to do. So thank you very much for this. If anybody has any comments, I don't think there'll be any question, but if anybody has any comments, I would love to share. Anybody could just free to share with it.